Hello, everybody. My name is Dio Giotas, and I am an Admiral Nurse in North Central London, one of the two. And I'm working alongside Robin Barker, who is my lead Admiral Nurse. Thank you for coming along, and I've been part of this community of practice, cancer community of practice for the last year, I think, or two, and it's been an amazing journey. And what I do in this community of practice is I talk about dementia and cancer. Over to the next slide, please. Today we are going to cover 4 key points, which is we're going to refresh our knowledge about dementia. We're going to talk about the risk factors in dementia and cancer, and we will just touch upon the challenges, the common challenges when living with dementia and cancer. And we're going to look at meaningful support that it is available for those affected by dementia and cancer. Now, in this slide, I like to talk to you about dementia and what dementia is. So dementia is a progressive neurodegenerative disease, with the term normally used to describe a range of long-term and life-limiting conditions that affect over time a person's cognitive, motor, and functional abilities severely enough to disrupt the usual daily living activities. That's why also dementia is a disability. The types of dementia, there are over 200 subtypes of dementia, but the most common one, the ones that are widely known are Alzheimer's disease, which normally affects about 75% of the people, vascular dementia, which affects around 30% of the people, then Lewy body dementia, which is affects about 25% of the people, frontotemporal dementia, and which is about 15% affecting people, and then mixed dementia, which is around 20% that affects people. So this is also, you might be familiar with young and late onset dementia, but young onset dementia is for everyone who is diagnosed with dementia under the age of 65, and late onset dementia is for those diagnosed with dementia over the age of 65. There are 2 major categories in dementia, which is the cortical dementias, which is basically depends on the part of the brain that it is affected. For the cortical dementias, it is the cerebral cortex, which is the outer layer of the brain, and which is responsible for memory and language. For example, you would have Alzheimer's disease if that was the case. Subcortical dementias is for the part of the brain which is beneath the cortex. So in that situation, we see changes in the speed of thinking, the ability to start activities. For example, Parkinson's disease, Lewy body dementia, Huntington's disease. And for last is the stages of dementia. So there are 3 major stages, but they're not clear cut because dementia is unique to every individual and every family. So depending on the type of dementia that you have, the time of the diagnosis and the timing of the diagnosis, people may experience variable severity of symptoms. Next slide, please. Now, because Vicky touched upon, obviously talked to us about a mild cognitive impairment, I'd like to sort of, place dementia in this kind in where the cognitive impairment happens and goes into dementia. So imagine that there is unaffected cognition, which because of a cancer diagnosis, a brain cancer diagnosis, may move on to the mild cognitive impairment. But just because you have a mild cognitive impairment doesn't mean that you will develop dementia. Some will do, but not all people. And what I wanted to say about this is mild cognitive impairment can develop for multiple reasons, and individuals living with with this may go on to develop dementia. Others, as we said, maybe not. And for neurodegenerative diseases, the mild cognitive, such as dementia, mild cognitive impairment can be an early stage of the disease continuum, including obviously Alzheimer's, if the hallmark changes in the brain are present. Next slide, please. Now, dementia and cancer risk factors. So we will all agree that, age is one major risk factor because it can affect anyone at any age. Comorbidities such as diabetes, high blood pressure, anything like that could basically could lead to develop cancer or dementia, depending, obviously on the next risk factor, which is lifestyle. So if you're a smoker, a drinker, you don't quite, like much exercise, so then the risk of developing either or both diseases, increases. Environment is a major risk factor as well, because it's the built environment, as in the physical environment, where where people sort of are not simulated enough within the built environment, and there is no, and it's not quite friendly to accommodate soothing for their diseases, but also the environment as in community, the contact and the connectedness with the community. Deprivation or inaccessibility to healthcare is also a major risk factor. And genetic is, but it accounts for 0.1% of the cases in, when it comes to dementia. For cancer, it's actually higher than that. Lack of self-awareness in terms of, there are people who probably will see a lump or a bump, but they may just ignore it due to fear or anything else, and that will then develop into cancer. But also, mild, signs of dementia may be ignored if people are not aware of what those signs might be. Abrupt health events such as a stroke, a brain injury can also lead to dementia, and also miss or under-diagnosis of either conditions, because sometimes cancer is more prominent, so dementia is rather underdiagnosed. Next slide, please. Now, these are the most common challenges that people with dementia and cancer may be experiencing. And by that, I mean accepting the diagnosis, managing the symptoms of both diseases, lack of awareness when it comes to available services for support, the multi-dimensional impact of the diagnosis of both diagnoses, the day-to-day practicalities from keeping up with with appointments, phone calls and everything, and then obviously facing the future. Next slide, please. Now, in this slide, we see the key points, which is the 5 stages of grief, where everyone receiving a diagnosis either of cancer or dementia or both will go through, and those stages. Excuse me, I've lost this. And those stages are, the 5 stages of grief are denial, anger, bargaining, depression, and acceptance in the end. But not everybody goes through, this specific order. You can start from any, people start from any stage, and they, may experience some or all of those stages. Increased risk. So in terms of the risk, there is a very recent study about suicide, especially when facing a dementia diagnosis. That study happened in England, and it was over 600,000 people living in England who basically. And that showed that there is a 7 times higher risk in people under 65 years old experiencing really dark thoughts and attempting suicide after in the first 3 months after getting a diagnosis of dementia. Now, moving on to the next key point, I think clarity in the message when we deliver a diagnosis to any individual. we deliver it to both family and patient. So we have to be specific that this is dementia as much as we are specific about having cancer. Um, it's a triadic approach. So because the diagnosis is not just for the person living with the condition, but with the family as well. Because if you care for someone who lives with dementia, you live with it too. And you need to have a plan ahead, a clear plan of what happens next. Well, you deliver the diagnosis, so how we move on from this stage? What do they need to do? Maybe signposting would be a great idea to use. And education, people need to know more about the condition, so then they can equip themselves with the courage, the bravery, but also the skills to fight against both diseases. So what will enable that? So these are the attitudes that you see on the right-hand side of the slide, which encapsulate the key messages of what we need to be as professionals in order to support those under our care. Next slide, please. Now, supporting families and informal carers. So, just as I previously said, the diagnosis is not just for the person living with a condition; it's for the whole family. And imagine that those families, they are not just, elderly couples, because dementia can affect anyone at any age. That means that if you are 30 or 40 or younger than that, you may have young kids, you may be still in employment, you may be dealing with other situations, have a mortgage, or you name it. So I think what would be really meaningful in terms of support to all those carers that we have seen as admiral nurses out there is we need to support them to tackle or to deal with the anticipatory grief, which is the feeling of and the situation where you feel that you lose someone, but they are still, you lose the person, your person with dementia and cancer, but they are still there, standing right in front of you. So you experience all that bereavement, all that grief, while they're still there. Carers needs assessment, that is a comprehensive assessment that actually identifies all the needs of that a carer might have, and also comes with a with allowance. Lasting power of attorney, means that making a plan for when things are no longer the same, for when the person lose their capacity to make decisions for their care. So they appoint someone, and that has to do so, and that has to happen as early as possible after diagnosis, preferably around the time of the diagnosis.
Reminder to keep your mics off, please. Otherwise, it's really disruptive for the speaker.
Thank you, Sandra. Attendance allowance is another help, another allowance that could benefit the people, especially those because carers will often have to give up on their own jobs, give up on their lives. So income drops dramatically in the family. We need to link them up. We need to link them up with carer support groups. With carer support groups, where they can actually link up with people who experience the same situations in their families, who live with dementia and cancer, or either conditions. It's important to make sure that we support the carers and the people with dementia, and those, obviously with cancer too, in terms of physical and mental health, and that can happen with regular checks. We will talk about this a little bit further down, but this is just to basically reiterate how important physical and mental health is for people who actually are informal carers, for those who are living with with both diseases. Emergency card is another important part to have, because you can carry that with you. So if anything were to happen to you, and the person that finds it, then they will know that there is a person at home that needs support, and they will get to them. Training and education, we need to increase their awareness. We need to make them aware of what to expect, and equip them with skills that enable them to face the future with a brighter future. And the enablers for that is You can put alerts on your systems and basically mark them as, being the informal carer of the person that lives with, with those conditions. Carers group, focus groups and feedbacks. Some GP surgeries do have those, so they consult with, patient groups and carers so they can see how they can improve things. We need to be culturally sensitive. We need to make sure that we are inclusive in our approach, rather than trying to just, wherever it is not, of what we know, then we just can't care. That's not how we think things work. We live in a society. We live in a nation where, people come from all over the world. We need to be culturally sensitive. Respite care, so they get a little bit of a break, so they can actually catch up with things that they just couldn't. NHS health checks, which is a service offered by any GP practice from people in England that are 40 years old to 74 years old, I think. So services for support mental health, such as, cognitive stimulation therapy, cognitive behavioral therapy, and counseling. There are plenty of opportunities and plenty of services out there, virtual, face-to-face. We will get to that. Signposting to services. You can't possibly know everything. So we need to ensure that when it comes to things, we just, acknowledge and appreciate our own limitations, and understand that there are other people who are specialists in certain fields, including services, where they can actually support our patients. And activism is not, sometimes comes with a negative connotation, but I think it is a wonderful thing to have. People advocating for their own diseases, their own health, and their own rights. And remember that, dementia is a disability. So carers are not carers. Why? Because they are people like you and me. They are people. They are John. They are Shirley. They are Mohammed. They are Karine. They are husbands. Their wives, sons, daughters. So do call them by their names. Address to them, by their relational capacity. So this is the husband of Mrs. Smith, not the carer, Mrs. Smith's carer. So that's the thought to take away, because I see that quite a lot. The next slide, please. Effective management of symptoms. So the key points on the left-hand side talk us through what's really important. What is that we need to take into consideration. We need to be proactive and provide those checks and those reviews to the people affected by both dementia and cancer, by healthcare checks. We need to make sure that any infection, any abnormality, any imbalance is caught before it becomes problematic and disruptive to the person's daily living. Medication treatments and optimizing the medications, polypharmacy. So we need to be realistic and pragmatic when it comes to treatment, and acknowledge that not every medication will work, for everybody. Personalized symptoms management. That includes that not everybody will get what's expected of the average person living with cancer or dementia. So that means that we need to keep on top of sickness and pain and constipation, diarrhea, dehydration, all that. So we need to make sure that all those symptoms experienced by both, by people affected by both conditions are managed properly. Partnership work, as I said just previously, we can't possibly know everything. Reaching out to specialists, reaching out to services, and just for a quick consultation to say, oh, that reassurance that we're doing the right thing. Mental health and support groups, they are, they work a treat. They just, they do the impossible possible. They help people keep up with their mental health. Granting access, direct access to your services. Many people I look after, and Robin and I know that really well, that they just, the most common complaint is, we have to sit in a queue of 20, call queue of 28 people whilst being in absolute agony, or having someone in absolute distressed behavior at home and not knowing what to do. So you may need to consider granting direct access for these vulnerable groups, and also access to, I don't know, patient access, so they can request repeat medications without having to ring you. alerts on the system that this particular person is a cancer and dementia patient, and this is a carer of a person that lives, that's living with cancer and dementia. We need to look at the environment of our service. Is it friendly enough for the people living with both conditions? Can they see where the toilet is? Can they see, where they need to be sitting or waiting? Can they find the door to get into the practice? These are really basic things that make all the difference. And obviously,
Yeah, I'm just going to interrupt for a 60-second warning. Apologies.
oh, brilliant. Okay, thank you. Coping with body changes. So, which means that, people see those scars, hair falling. They need to be supported. On the right-hand side, you can actually see all the enablers there. Don't worry, all the slides will be distributed to you after this webinar. Next slide, please. The power of signposting. I have created, I have spoken. I can't speak highly enough of signposting to services. You can see the reasons why on the left-hand side, and on the right-hand side is something that I created just for you attending today this webinar. So you can actually, download it, put it on your desktop, and just, refer your, and then using Accurex or whatever have you, to send information out to your patients and their carers. Next slide, please. So multidimensional impact of both diagnoses, personal, your whole world is upside down. You are struggling to cope with the diagnosis or the day-to-day things. Family, family are also affected because diagnosis is not just for the person that lives with a condition. Societal, stigma, inaccessibility, you name it, financial, job loss, there is a lot that we can talk about. I can talk about these things forever. Next slide, please. Overcoming, day-to-day practical difficulties. You see on the left hand side all the key points that lead to understanding how we can overcome that, and obviously the enablers on the right hand side. Oh, next slide, please. Facing the future with confidence. We talked about all that already, and you can see on the left-hand side and the right-hand side, we have the key points to take into account and what will help us get to that. Next slide, please. That's a major point. We all need to have, everybody who has a diagnosis of dementia and cancer has to have an advanced care plan in place. You see the details there and how that is. Next slide, please. For the care home special, I'm really sorry, but I think I wish I had more time to talk about it. I probably overran, but you can see certain aspects of what I was hoping to say. But you will get that, the quick reference guide, and that that will help you sort of understand where I'm coming from. And next slide, please. And that's what it looks like. The dementia desktop guide. And now I'm probably have to hand over to Tanya Navarro, who is an advanced care planning occupational therapist in Tower Hamlets. And thank you for listening.